Imagine waking up one day and feeling older, not just tired, but slower, foggy, weaker, a little unsteady on your feet. Your memory isn't as sharp, your mood feels off, your energy is gone even though you slept fine. Most people shrug and say, well, I'm getting older. This is normal after 50. But what if it's not aging at all? What if one silent vitamin in deficiency is copying the symptoms of aging so perfectly that millions of people never realize they're deficient until the damage is already done? Today, we're talking about vitamin B12 deficiency, the deficiency that can imitate aging, accelerate brain decline, weaken nerves, drain energy, and quietly steal your quality of life after 50. And the most shocking part? Many people with this deficiency have normal blood tests and still suffer. Let's break this down. Vitamin B12 is not just another vitamin. It is essential for nerve health, brain function, red blood cell production, and DNA repair. Without enough B12, your nervous system literally begins to malfunction. After the age of 50, the risk of B12 deficiency increases sharply, not because people stop eating it, but because the body stops absorbing it properly. Here's why. To absorb vitamin B12 from food, your stomach must produce enough stomach acid and a protein called intrinsic factor. As we age, stomach acid naturally declines. Add common medications like antacids, proton pump inhibitors, or metformin, and absorption drops even further. So you could be eating meat, eggs, or dairy regularly and still be deficient. Now let's talk about the symptoms. This is where B12 deficiency becomes dangerous, because the symptoms look exactly like aging. Memory lapses, difficulty concentrating, brain fog, slower thinking, mood changes, depression, anxiety, irritability. Many people are told they have age-related cognitive decline, or worse, early dementia, when the real issue is B12 deficiency damaging brain cells. B12 is required to maintain the myelin sheath, the protective coating around nerves. When B12 levels drop, this coating breaks down, signals between the brain and body slow or misfire. That's why people experience numbness or tingling in hands and feet, burning sensations, balance problems, or frequent falls. They may feel weak, clumsy, or unsteady, again, blamed on aging. But this is neurological damage, not normal aging. Energy levels also collapse. Vitamin B12 is essential for making healthy red blood cells. Without it, oxygen delivery drops. This leads to fatigue that feels deep, heavy, and unrelenting. People describe it as feeling drained, even after rest. They lose motivation, exercise feels impossible. Doctors often blame stress, sleep, or age, missing the real cause. Now here's something even more alarming. B12 deficiency can permanently damage nerves if left untreated. Early symptoms are reversible, late-stage damage may not be. That's why awareness matters. Let's talk about who is most at risk after 50. First, adults over 50 in general, because absorption naturally declines. Second, people taking acid-reducing medications. These drugs reduce stomach acid, which is required to release B12 from food. Third, people with diabetes taking metformin. Metformin interferes with B12 absorption and is one of the most common hidden causes of deficiency. Fourth, vegetarians and vegans, because B12 is primarily found in animal products. Fifth, people with gut issues, like gastritis, IBS, Crohn's disease, or a history of stomach surgery. And here's the trap. Many doctors test serum B12, and if it's within range, they move on. But functional deficiency can exist even with normal numbers. Symptoms can begin when levels are below optimal, not below the lab cutoff. This means people suffer for years while being told everything is fine. Now let's clear something up. This is not about megadosing vitamins blindly. It's about recognizing a biological vulnerability that comes with age and addressing it intelligently. So how do you protect yourself? First, awareness. If you or someone you love is over 50 and experiencing unexplained fatigue, memory problems, balance issues, numbness, or mood changes, B12 deficiency should be considered. Second, testing wisely. Beyond basic serum B12, functional markers like methylmalonic acid MMA and homocysteine can provide deeper insight, but even symptom response matters. Third, proper supplementation. Many older adults cannot absorb B12 efficiently from food, but sublingual B12 oral high dose supplements or injections bypass absorption barriers. The form matters too. Methylcobalamin and hydroxycobalamin are often better utilized than older synthetic forms, especially for neurological symptoms. Fourth, consistency. B12 deficiency doesn't develop overnight, and it doesn't reverse overnight either. Nerve healing takes time, but improvement in energy, clarity, and mood can begin within weeks. Now let's address the elephant in the room. Is this really that common? Yes. Studies show that up to 20–30% of adults over 50 may have low or borderline B12 levels. Many more have functional deficiency, yet it's rarely discussed as a cause of aging symptoms. Instead, people are told to accept decline as inevitable. That's a mistake. Aging is real, but accelerated decline from deficiency is not inevitable. You don't suddenly become forgetful, weak, numb, and exhausted just because you turned 55 or 60. Often, something is missing, and sometimes it's one vitamin. Vitamin B12 deficiency doesn't just mimic aging, it speeds it up. Unchecked inflammation rises, nerve damage accumulates, cognitive reserve shrinks. But when addressed early, quality of life can dramatically improve. People report sharper thinking, better balance, more energy, improved mood, not because they reversed aging, but because their nervous system finally got what it needed. So here's the takeaway. If you're over 50, don't ignore symptoms that get blamed on age. Aging should be gradual, not sudden, disabling, or confusing. And if one simple nutrient deficiency can steal years of mental clarity and physical independence, it deserves attention. Talk to your healthcare provider. Ask the right questions. Don't settle for "this is normal," because sometimes what looks like aging is actually a fixable deficiency. If this video helped you understand your body better, share it with someone over 50. It might change their life. And if you want more science-backed videos on nutrition, brain health, and aging, subscribe and stay informed. Your future self will thank you. Memory loss, brain fog, fatigue, balance problems, and numbness are often brushed off as just getting older, especially after the age of 50. People start forgetting names, losing focus mid-sentence, or feeling mentally slow, and they assume this is a natural part of aging. But in many cases, these changes are not caused by aging itself. They are classic warning signs of vitamin B12 deficiency. Vitamin B12 plays a critical role in maintaining healthy brain cells and protecting nerves. When levels drop, the brain struggles to communicate efficiently, leading to poor concentration, confusion, and memory lapses that can look frighteningly similar to early dementia. At the same time, damaged nerves may cause tingling, numbness, or burning sensations in the hands and feet. Balance issues and unsteady walking can appear because nerve signals to the muscles are delayed or distorted. Fatigue adds another layer, as low B12 reduces red blood cell production, limiting oxygen delivery to the brain and body. Together, these symptoms create a picture that strongly resembles accelerated aging, causing many people to miss the real problem. The danger is that untreated B12 deficiency can lead to lasting nerve damage, making early recognition essential rather than dismissing these changes as normal for age. Many people believe that eating meat automatically protects them from vitamin B12 deficiency, but after the age of 50, that assumption often fails. As the body ages, stomach acid production naturally declines. This acid is essential for releasing vitamin B12 from food, so it can be absorbed later in the intestine. When acid levels are low, B12 passes through the digestive system unused, even if the diet contains plenty of animal products. Common medications make this problem worse. Acid-reducing drugs such as proton pump inhibitors and H2 blockers, often taken for reflux or gastritis, significantly reduce stomach acid and quietly block B12 absorption over time. Diabetes medications, especially metformin, interfere with B12 uptake in the gut and are one of the most overlooked causes of deficiency in older adults. On top of this, age-related changes in the stomach can reduce production of intrinsic factor, a protein required for B12 absorption. The result is a hidden deficiency that develops slowly and silently. People continue eating normally, assume their nutrition is adequate, and never suspect a vitamin problem until symptoms appear. This is why B12 deficiency is so common after 50, even among regular meat eaters. Vitamin B12 is essential for protecting the nervous system because it helps maintain the myelin sheath, the insulating layer that surrounds and protects nerves. This sheath allows electrical signals to travel quickly and accurately between the brain and the rest of the body. When B12 levels are low, myelin begins to break down, causing nerve signals to slow, weaken, or misfire altogether. This damage explains why people with B12 deficiency often experience numbness, tingling, burning sensations, muscle weakness, and problems with balance or coordination. In the early stages, this nerve damage can be reversible. Restoring adequate B12 levels allows the nervous system to repair the myelin sheath, leading to gradual improvement in symptoms such as energy, sensation, and mental clarity. However, if the deficiency persists for months or years, the damage can become permanent. Nerves lose their ability to fully recover, even after B12 levels are corrected. This is why delayed diagnosis is so dangerous. Symptoms may be subtle at first and easily dismissed as aging, but ongoing deficiency quietly causes structural nerve injury. Early recognition and treatment are critical to preventing long-term disability and protecting brain and nerve function. Many people are reassured when a blood test shows their vitamin B12 level is normal, but this can be misleading. Standard serum B12 tests measure how much B12 is circulating in the blood, not how well it is actually being used by the cells. Nerve and brain cells require active, usable B12 to function properly, and in some cases, this functional supply is insufficient even when blood levels appear acceptable. This situation is known as functional B12 deficiency. It can develop slowly and persist for years without being detected, while subtle nerve damage continues in the background. Symptoms such as brain fog, memory issues, numbness, or balance problems may appear long before lab values fall below the official cutoff. Additionally, different laboratories use wide reference ranges that may label borderline levels as normal, despite being too low for optimal neurological health. Factors like poor absorption, chronic inflammation, and genetic differences in B12 metabolism can all contribute to this disconnect. As a result, people are often told nothing is wrong while their symptoms worsen. Understanding that normal does not always mean optimal is crucial for identifying B12-related nerve dysfunction early. When vitamin B12 deficiency is correctly identified and treated, the improvements can be dramatic. Proper testing looks beyond basic blood levels and considers symptoms, risk factors, and how the body is functioning overall. Once deficiency is recognized, choosing the right form of B12 becomes essential. For some people, high-dose oral or sublingual B12 is enough to restore levels because these forms can be absorbed passively, even when stomach acid is low. For others, especially those with severe deficiency or neurological symptoms, B12 injections may be necessary to bypass absorption problems completely. The form of B12 also matters. Active forms such as methylcobalamin or hydroxycobalamin are often better utilized by the nervous system, particularly for brain and nerve recovery. With consistent treatment, many people notice clearer thinking, improved memory, better mood stability, increased physical strength, and reduced numbness or balance issues. Energy levels often rise as oxygen delivery improves and nerve communication becomes more efficient. While recovery takes time and varies from person to person, early and appropriate B12 support can significantly restore quality of life and prevent further neurological decline.